What's emerging from today very clearly is that radical change is required, that there are people here who are running the health service and involved in it in one way or another who know that is the case. The great challenge is how to get from here to there. It's got to be done, and that is going to engage. You know, I'm a journalist. I'm radio and television. That's got to engage the public. So the clinicians have got to be involved. There's got to be, quotes, buy-in if it's going to happen. If it doesn't happen, there's a train crash. If it does happen, we can really look forward to a good service. So I've got no particular solution, no particular idea. That's what the brains are discussing here, and in a very positive and engaging way.
Well, it's not about having, I think, one single vision. It's about how you can pick things from each of the presentations in order to create a new vision. And the one I found very interesting was from Airedale about the way they're using teleconferencing or just video conferencing to you and me of consultants and specialists into care homes in order to give direct face-to-face care to the individuals there and improving the care and reducing, for example, use of emergency admissions from those homes. So that's an idea that could be easily spread.
I think the thing that I've been really taken with is some of the issues we're looking at around the future of primary care and how we deal with a different cohort of patients to what we were perhaps dealing with 10, 20 years ago in a way that is centred around the person and not centred around some structures that we've historically got for providing care. So where I would like us to be is thinking about, for example, the proportion of the population who are frail and elderly with complex needs, because it may well be that what they need is not something which is provided for by a traditional district general hospital, general practice model.
By far and away the winner for me today so far is the work going on at the Airedale NHS Foundation Trust, and they've developed some really great looking coordinated care packages, so people living in the community with care being coordinated around them and their needs, but using telehealth to support that.
I think it was the acknowledgement that no change isn't an option. We set out really early in the day that this is not just a £30 billion financial challenge, but there is a quality challenge in all of this as well. And the vision that we heard from Terence Stevenson set out that challenge very crisply, and it set out that we have to change. We have a model of care that is no longer appropriate for the times that we live in. And certainly in the groups that I've been talking to, everyone agrees.